Chikungunya outbreak in China. What we know so far. Context and magnitude of the outbreak. The Guangdong province in southern China, particularly the city of Foshan, is facing one of the largest chikungunya outbreaks in its history. Since June 2025, more than 7,000 confirmed cases have been reported, with about 90% of them concentrated in the Shunde district. This is shaping up to be the largest chikungunya outbreak ever recorded in China. Triggering factors. The peak of the summer monsoon, with heavy and continuous rains, led to widespread stagnant water areas, ideal breeding grounds for the mosquitoes that transmit the virus. The hot weather and flooding worsened the spread. Symptoms and clinical progression. Chikungunya is transmitted by Aedes mosquitoes, such as Aedes aegypti and Aedes albopictus. Main symptoms include sudden high fever, muscle pain and severe joint pain, especially in hands, wrists, ankles, and feet, fatigue, headache, nausea, and rash. While most cases are mild and resolve within a week, some people may develop chronic joint pain lasting months or even years. Deaths are rare, about 1 in every 1,000 cases, and mostly occur in elderly individuals, children, or those with chronic conditions. China's public health response. To control the outbreak, China implemented a set of measures reminiscent of the COVID-19 pandemic restrictions. Patient isolation in mosquito-proof hospital beds, 7,220 beds were prepared in Foshan. Widespread use of insecticides, mosquito nets, and drones to locate breeding sites. Fines of up to 10,000 yuan, US $1,400, for residents who leave water standing in open containers. China has also applied biological control strategies, such as introducing predator mosquitoes, Toxorhynchite splendens, and larvae-eating fish in affected areas. Federal emergency funding of over 1 billion yuan, US $139 million, was released to support flood recovery and outbreak containment in the region. International alert and preventive recommendations. The U.S. Centers for Disease Control and Prevention, CDC, issued a Level 2 travel advisory, warning travelers of the risk in Guangdong province. Travelers are advised to consider vaccination, where available, and follow preventive practices such as using mosquito repellent with DEET, wearing long sleeves and pants, using bed nets, and eliminating standing water. Currently, the vaccines Ixchiq and Vimkunya have been approved in countries like the US, EU, Canada, and Brazil, but distribution remains limited. Some regulators had paused their use in older adults but resumed vaccination campaigns in July 2025. Medical guidance. Symptomatic treatment includes rest, hydration, and acetaminophen for fever and pain. Anti-inflammatories should be avoided until dengue is ruled out. High-risk groups, elderly, children, pregnant women, should be monitored closely. Public education campaigns are essential to promote prevention and help trace cases and their contacts. Compass conclusion. The chikungunya crisis in Guangdong shows how extreme weather events like monsoons can spark mosquito-borne disease outbreaks in areas with no prior immunity. With thousands infected, local and global efforts are critical, both in terms of public health systems and individual prevention behaviors, especially in high-risk environments.